Good afternoon, everyone, and welcome to this webinar with SATSA. We have 500 people logging in today to join our panelists. This is a clear indication of our need for up-to-date information advice at this unprecedented time. The situation is evolving rapidly, and we have collected and collated hundreds of questions that we will be posing to our panelists today. We will unfortunately not be taking questions live. We have a lot to get through in the next couple of hours, as you can appreciate. But if you would like to send questions to SATSA, you can do so by using the survey link that we have publicized widely on our newsletters and on the website. But also I have pasted it in the chat here now. So you'll see there's a SurveyMonkey link in the chat. You are welcome to click on that link and to post any questions that you may have that you would like us to respond to on the SATSA microsite. Our team is working around the clock to get you the answers you need. We really want to support you as much as we can at this time, and we thank you for your patience with trying to get you specifics. To that end, we've managed to bring together a really great panel today to help us with some of the questions that have come through. The situation, as I said, is evolving very quickly, and there are a lot of specifics that we don't have the answers to, but we're going to do our best to get through as much as we can. So allow me to introduce your panel today. Of course, we have CEO David Frost and our President Tony Romo, who is going to be representing the Sales Thought Leadership Forum. We also have Professor Lucille Blumberg from the NICD, who is currently on a World Health Organization conference call. So she'll join us later and we'll get some information from the coalface. We have Martin Wiest from Tourvest Destination Management and Judi Nwokedi from the Black Business Council to give us some macroeconomic guidance. And we have Teresa Schade from the Solomon Holmes attorneys to provide us with labor-related guidance. Once again, we are unable to take questions during the session. We simply cannot get through all of them. We will be posing questions selected from the hundreds of questions we have already received over the past few days to our survey, which you are welcome to still input into. And again, that link is in the chat. Please feel free to put your questions into that SurveyMonkey. So on that note, I'd like to hand over to David, our CEO, to get us kick-started. David, the floor is yours.
Thank you, Natalia. Good afternoon to all our SATSA members and to non-SATSA members who have dialed in. Sure, guys, this is, it feels very much like sort of, I suppose, England in 1939, 1940, this is the BBC, and here we are up against it. This is unprecedented. It's murky waters. I just want to, before we get going, I just want to thank all the panelists who've made themselves available. I want to thank in particular Lucille Blumberg. She is literally the country's guru on this whole issue, and she has made herself incredibly available for SATSA and the industry at large. So we're really fortunate to have her with us today. I just want to also pay tribute to the SATSA team, and particularly Natalia, who has worked. Natalia literally is basically not sleeping. She's working around the clock, pulling this together. Obviously, SATSA is one of the constituents she is engaged with, but also with our colleagues on the outbound side, as well as a number of other clients. So guys, just as Natalia said, we've got some key issues that we are trying to get clarity for you on. And I think in these pressing times, what we need as much as possible is answers. We don't need to be told that discussions are taking place. We need to know that people who can make decisions are meeting and indeed are progressing towards key decisions that can help us through this process and will resuscitate our industry once we are through the storm. So what we are pressing for and what we are engaged on is to get real-time answers on key issues. We're very thankful for all the questions that have come in. We've grouped them, and we are going to sort of progress the discussion in quite an ordered fashion, starting with some micro business sustainability issues, and then we're going to move on to some macro issues around business sustainability. We really pleased to have Judi Nwokedi with us. She is involved in the Black Business Council. She sits on NEDLAC, and that is the body that is basically making and forging a lot of the decisions that we need going forward. So we're going to be doing that, and then Tony and Martin are going to then, after that, go into a discussion around a lot of the issues around contracting, cancellations, the relationship between DMCs and product. We are hoping to forge a common view here. It's in our interests, guys. It's in our interest as a destination. It's in our interest to preserve as many businesses as we can. So we look forward to that discussion. As Natalia said, Prof. Blumberg will join us when and if she's off her World Health Organization call, and we'll insert. And we are seeking questions from and answers from Lucille on a lot of the medical issues and how the virus is projected to spread through the country. We're only going to get out the other side once we've been through it. So this is really really into the forge. I'm just going to deal with one key question that came out. It was SATSA members asking about if there is a way that in any way we can ameliorate payment terms. So let me thank all those members who have paid up to date early in the year. There are still a number of outstanding fees. Guys, we need to do the work on your behalf. We are doing, I think, as good a job as we can in really pressing times of coordinating and getting industry views through to our public sector bodies. At the same time, we are also able to try and seek information as best we can. We are also here to lobby on your behalf and to put solutions, however wild and wacky they may be at this stage, that can help sustain businesses through this crisis. So I just want to make it clear, I think it's in all our interests that SATSA is preserved through this process. To that extent, we are really open to payment terms that people can pay us off in sort of monthly installments. At the same time, we are with you in this. We are acutely aware of the financial pressures that all our SATSA members are currently experiencing. We have moved to immediately, and we're doing this whole webinar remotely. We've moved to a work to home situation, and we are going to be transforming and tailoring the SATSA business according to our finances going forward. We in this with you, so I just want to really reassure people of that. But once again, to thank everybody who has stood by us through the process. With that being said, let me hand back to Natalia, who's get the discussion going on some of the more specific questions that people have sent in. And I will come back at the end of the webinar with one or two comments. Thank you.
Thank you, David. Right. I just want to welcome Professor Blumberg, who has joined us. I have muted you, Prof, just temporarily, and I will obviously unmute you when I need you to have a chat to us. But first, I'd like to lean on Teresa, if you could please just unmute yourself. And I know that Anthony is with you as well, which is absolutely great. We are wanting, obviously, to unpack a lot of the questions that we have received from members around staff issues. So things like retrenchments, things like putting staff on 50%. What are the kind of legal things that we need to be thinking about as tourism businesses currently to ensure that we're protecting our staff first and foremost, but also their jobs?
Thank you, Natalia. Anthony Solomon here, Solomon Holmes. Natalia, I think the most pressing question for most of your members would be whether they can, or they're facing really the possible closure of their businesses, if not, hopefully not for the long term, but for the short term. The options available to employers are threefold. And ideally, we want to try and avoid retrenchments. But if your business is in a situation where you simply cannot continue to employ employees at this stage, the first option would be to discuss layoffs with them. The concept of a layoff is that the employee remains in your employ, but is then not paid for a period of time in anticipation that you'll be able to get the business going again in the short term. That's probably the first option that one should look at. The other option, which runs simultaneously, is the option of short time. where you negotiate with employees to work short time. The difficulty for employers with both these two options is that it requires the agreement of the employee, and for larger employers, the agreement of possible trade unions. Now, we've seen a trend, certainly over the last 2 weeks, where trade unions and employees are open to these options. And certainly, we would advise that you first pursue either a layoff or short time. Where you can't reach agreement with your employees, or simply where you have no other option, then of course you're entitled to look at retrenchments. And I'm not going to go into that detail for the moment because I understand we're short of time, but where you want to retrench employees, employers are required to issue what's called a Section 189 notice in terms of the Labour Relations Act. The notice, if you go into the Labour Relations Act, the section itself under Section 189A details what's required in that notice. Certainly, we would advise you to get advice from your labour consultants or lawyers such as ourselves before doing that. It requires a process of consultation. That process itself, if you're a small employer, there is no limit in terms of the time frame, and you can enter into those consultations quite quickly. And certainly with small workforces, those sort of consultations can be completed in a matter of days if need be. If you do decide you need to dismiss employees, then you will be required to dismiss them on notice. And the notice periods ordinarily, unless it's contained in your contracts of employment, would be found in the Basic Conditions of Employment Act. Ordinarily, if it's someone who's worked for you for less than a month, it would be 1 week's notice. For less than 6 months, then 2 weeks, and for thereafter, 30 days notice. And you're required to pay out an employee for that notice period. You would also be required to pay them a severance benefit. The minimum severance benefit that you're required to pay under the Basic Conditions of Employment Act is 1 week per completed year of service. If you're unable to pay that, if you're financially not in a position to pay that, there is provision for you to seek to approach the Department of Labour. And again, you would need to get advice from a labour consultant or a labour lawyer in respect of that. Natalia, briefly, I think those are probably the key issues that our employers are looking for. Would you like me to deal with some of the health and safety issues?
I first would like to just understand if you think there would be the possibility of dispensation to circumvent this consensus-seeking process, because things are moving so quickly at the moment. Do you think that that is a possibility at all?
Natalia, I don't think so. I think that it's the idea that that terms and conditions can be changed without the agreement of employees is unlikely to happen. It's part of our common law, and it's certainly entrenched in the employment legislation. So, in terms of the two first options that I gave you, short time and layoffs, you're going to require the agreement of your employees. I'm not sure if that answers the question you're looking for.
It does, thank you. I wanted to just check in with you with regards to UIF. So is there a possibility that the industry could build a precedent and access the UIF without having to go the retrenchment route?
Yes, Natalia, as of yesterday, and it's been impossible for us to try and get hold of the Department of Labour today, we've tried, but there appears to have been a press release which has suggested that that the department is looking to rely on the National Skills Fund for support, and that they will be setting aside monies which will allow employees who are laid off to then claim unemployment insurance. Now, the details of that, I think, are going to roll out. I think there might be a panelist here who is with NEDLAC, and I know that NEDLAC was in discussions with the Department of Labour yesterday. I think that for members on the line, the SATSA we will assist SATSA in putting out information as to what the options are there. But certainly, in previous situations such as this, the Department of Labour, working with the Unemployment Insurance Fund, have made available what was called a training layoff scheme. And that scheme appears still to be alive. And again, it allows employees with their employers to, through the CCMA and the Department of Labour, work in conjunction with your SETA, your Sectoral Education Training Authority, to access funds which will assist in paying unemployment while employees are on layoff, as well as looking at training schemes. Now, those details, I think, will still be forthcoming from the Department of Labour, and we will be publishing those on our website, and I think we will share that obviously with SATSA so that they're available to their members.
Thank you. So for those of you who have joined us slightly later, I would just like to let you know we are not taking in questions through this webinar because we have a lot of questions that we've already received through our survey. Should you wish to pose a question, please go onto that survey link and post your question. We will endeavor to respond to that online on the SATSA microsite that we are literally on an ongoing basis updating. So we will deal with those questions, but we will deal with them off this platform. We already have lots of questions that have to come through here. On that note, Anthony, would you like to talk about health and safety for us?
Yes, so on that issue, in terms of the things that we've discussed, and in terms of employers' rights in dealing with employees through this period, we've drafted a draft policy, a coronavirus policy effectively, which is available on our website, and it's just gone live on our website, and we'll make it available to the SATSA website. The policy tries to deal with all of the issues that you might find yourself dealing with as employers. So, for example, if an employee is showing symptoms, what are your rights? If an employee feels that they need to put themselves into voluntary quarantine or voluntary isolation, what are your rights and what are your obligations in terms of payment? That policy is trying to deal with a lot of those issues, and we invite you to go onto our website to find it. And as I said, certainly at the end of this session, we'll try and put it onto the SATSA website as well. Just a brief comment on health and safety at the workplace. Employers have a duty to maintain a healthy workplace, and that would mean ensuring that their employees and their customers and guests are not infected by the virus. We believe that you would be entitled as a guest, if you run a guest or a lodge or a hotel, you'd be entitled to ask persons who appear to have the virus, in other words, they're showing symptoms, not to provide them access or to deny them access. Again, in terms of your business and the sector, you'll have to apply your own discretion in how you deal with that. Certainly, you would be entitled to ask a guest to self-isolate themselves within a hotel. Those are all options which really are just common sense, and your members would be entitled to take those sort of routes when confronted with these sort of situations. In terms of their employees, obviously, countrywide, employers are being encouraged to allow their employees to either work from home or not to come in at all. Now, in your sector at the moment, and I say this not tongue-in-cheek, it's a sad reality, is that I suspect you don't need your employees at the moment because your businesses are pretty much shut down. So there would be nothing wrong with you at this point asking your employees to stay at home. Certainly, you are entitled to to tell your employees and instruct them to take annual leave right now and to utilize their annual leave during this period where they are not required.
I'm going to actually do what I said I wasn't going to do and take this question because it's actually a question that I do think is a very useful one. So would you be able to combine short time or layoff with UIF, Anthony?
Yes, it appears that is allowed, and it is something that the scheme allows for, so yes.
Okay, great. Prof, I am going to unmute you. I recognize that your time is very precious and we are very grateful to you for joining us. So I've unmuted you now. I wanted to give you the floor. Basically, give us an update on where we are, where we're going, and then we'll get into the questions.
So thanks very much, Natalia, and good afternoon, everybody. It's really incredibly busy. We are at the beginning of our outbreak. We have over 100 cases, and the cases are increasing daily. They're still predominantly in returning travelers from high transmission areas, which is pretty well most of the Northern Hemisphere, Europe, USA, still Southeast Asia, but particularly Europe, UK and USA now. We have a couple of cases who did not travel, most of them, and it's really less than 7 or 8, where there is a link to an imported case or a known ill traveler who might not have got tested. So it's more local spread. We don't know that there's much community spread at the moment. We're not testing the community for respiratory infection, so we don't have a true picture. But I would expect that in the next couple of weeks, imported cases will go down because there's a lockdown. People are simply not traveling, they're trying to get home. And there's no doubt that it will move into the community. And I think that's been shown everywhere else. Majority of cases are mild. We've had 1 or 2 with pneumonia. We've had no deaths so far. I think this is a critical period for us to ramp up our responses, to identify cases, to isolate those who are ill, to quarantine and to track contacts and quarantine. And we've set up some new computer systems to facilitate the process. I think in an outbreak like this, that's really running ahead. You are always behind the epidemic curve. And on the WHO call that I've just come off, it's very clear that you have to use this period to do as much as you can, especially to prepare your health system for what is inevitable, that you will get admissions, you will get complicated cases, and you will get persons who need intensive care. Given our limited resources, competing priorities, high burden other diseases, this is really quite a challenge. The health business sector, the private one, has really come together in an incredible way to support the efforts and to support the public health system, which, you know, I think is absolutely under-resourced. In terms of tourism, it really breaks my heart when it's a business very close to my heart. I'm very passionate tourist, and I know the importance of us for income, for job creation, and I think that's really the tough part. The medical part, well, we have to cope with the impacts on jobs and job losses is really very tough. I think what's really difficult, hearing from other countries, is knowing how long this will last and when to pull back. We're in a lockdown now, schools are closed, but how long does this need to go on for? And when you reverse some of the lockdowns, it would seem as though sometimes there's a resurgence, and I think that's what China is seeing now, and how to do this removal of some of the quite drastic measures. So we're early stages. Yeah, I think many of the employer issues with illness amongst employees is going to raise its head. We're moving into the flu season in May, June, July, and we will certainly still be in this outbreak at that stage. And I'm not sure how we're going to cope with the extra burden. I think vaccination of high-risk people, vaccination of people in critical posts is absolutely essential. But the reality is that there's a limited amount of vaccine, and most years people don't take it up, and so the orders are related to that, and there's no chance of ramping that up, and there's going to be a great run on vaccine when it's released next week. Yeah, I think we still, should encourage people to travel locally. There's lots of ways you can reduce transmission, but people are really quite afraid. And I think what most people forget is, or don't really know, is that the majority of cases are mild, and what is being done is to kind of, everyone talks about flattening the curve, but reduce and prolong what could be a real hit on a health system all at once. So yes, different parts of the world have tried different strategies. I think the Brits are letting it run, and improving, getting immunity up in the community and focusing on those in hospitals. I think Singapore did, find every case that's infected, so widespread testing, isolation, quarantine, making sure that people, really comply with those measures. I think we're in a different setting. We have people who can't quarantine at home because there are, 10 other people. They can't isolate at home if they've got the illness. And so that has been taken into account in the national, plan to make those resources available where you can quarantine, where you can isolate patients who don't need hospitals. But it's a lot to be done in really a very short period before I think we're going to see our increase. HIV, older people, we don't know exactly what the impact will be here, especially on our HIV, TB population.
Prof, if I could just come in there, because
yeah.
This is obviously a question that's on everybody's mind.
Yeah.
Do you have an idea, based on your scenario projections, what the size of the infections will be and how long, in your opinion, this will last? If you can answer that.
So I wish I could look into my bowl or the modeling or whatever. It depends on what you do, how long it will go on. I think there are lots of unknowns. I think China came with their draconian measures quite late. The outbreak was already going down, and how much impact they had on that, on the epidemic receding is not clear. Certainly they reduced the number of cases. We're doing some of these early, but we're not doing them totally. People are still going out, people are still going to work. I think it's balancing, keeping the economy going a little bit. Some people can't work, many people can't work at home. I think you've got to prepare for several months. I think that's the reality. It's not going to go away because we've closed the schools for 2 weeks. That's not going to, we're not in that big transmission phase yet. That's coming in the next 2 weeks.
I think we should, as an industry, deal with the pain now, shut our doors, shut down the hotels and the lodges now to stem the spread, or is that not something you would recommend?
I think people aren't traveling, so I think, still local people are traveling. I don't know, people really don't know the answer to that. Maybe, it's a half approach, I can't actually answer that. It's a question that's been asked. China will say shut down everything. Others will say identify those at risk and manage them. Others will say, well, reduce the transmission to those at risk. The rest can, get immune and you'll get rid of it quicker. Difficult.
How long would you put a travel ban in place for, in your opinion?
I think these are impossible questions. I think it's going to be, from what I hear, I think the next 2 months in Europe will be, the outbreak they haven't even reached their peaks yet.
Right.
So I would predict at least 2 months. But it's an absolute guess because they're all doing different things. And not all of it is 100%. And, everyone's experiences are different.
So we've had quite a few questions come in, which I know you are the person to respond to.
I don't have all the answers. I wish I did.
None of us do, but we need to rely on your expertise, your experience, and your common sense. So the government has said that anyone who has visited a high-risk country since the mid-February must present themselves for testing, but health centres say that
So that is not correct. I think...
Okay, tell us.
Yeah. So what we are recommending is anybody who's been to a high or medium risk transmission area, and countries are changing, from medium to high and coming on board with medium all the time, should quarantine for 14 days. 14 is chosen because that's the longest incubation period. Most people actually, if they're going to develop the disease, become sick a little earlier, 5 to 6 days. So 14 is a safety blanket. Should quarantine, should socially distance, in the home setting, and if they have any respiratory symptoms, should present for testing. contacts who are asymptomatic must must quarantine themselves. They're not ill, and if they develop symptoms, they should be tested. We cannot cope with everybody coming for testing, and if you test negative once, 2 days after you return, what does it mean? You know, it just tells you on that day you're negative. It doesn't tell you anything along that 14 days, so it doesn't make sense. So certainly there are some asymptomatic infected people, minimally symptomatic, those who don't share their symptoms or don't tell you about symptoms. But I think for the most part, those who are symptomatic should be tested. They're the ones who are most likely early on to transmit the infection.
And that's 14 days. So if they have been in South Africa or Botswana or Lesotho, whatever, for those 2 weeks without any signs of infections, there's really no need for them to be tested, correct?
Correct, but they should have been in quarantine. They
Right.
shouldn't be mixing. So that affects incoming travelers. I mean, most will not come for 6 weeks. Many will come, returning South Africans, it's easy. But tourists will not come for, 3 weeks. So they have 2 weeks in quarantine and 1 week enjoying a holiday. So it effectively, cuts off tourists who are coming into the country.
So let's say that the visitor actually receives a positive test result. What do we do?
Yes.
Do we?
So you will have to isolate them, not admitting all positive cases unless they have a risk for complications, and they normally complicate towards the end of the first week, over a certain age, diabetics, asthmatics, etc. Others who are uncomplicated, who are fit, can be isolated at home with good infection control measures. If they can't be isolated at home, we may have to send them to a hotel or get a whole hotel, and that is being considered, or an isolation center, which is what the Chinese did. Everybody who was positive, they put in an isolation center because they didn't trust home isolation.
Right.
You can't send them on an airplane back home, and that creates, problems around visas, about finances. They really have to wait out those 14 days. We don't want a diamond princess, scenario somewhere en route.
So let's say I am symptomatic and I then get tested. Obviously, I have to be quarantined pending the results.
Yes, you're quarantined pending the results. The results are quite quick, anything from 24 hours to 48 hours. They set up a lot of testing facilities all over the country now, mostly in private. Those are on the websites, and you fill in a form and you simply arrive and avoid everybody else at the testing site, and have your test done, and it's mostly automated, and then you tell them about your contacts, and everything happens. Yeah.
Well, walk me through. Let's say I am a traveler. I've been here for the last 10 days. I'm coming from France and I'm staying at a guest house in Stellenbosch. And I feel I have a little bit of a tickle in my throat. There's a dry cough. I'm showing symptoms. Is it my responsibility as the guest house owner to make sure that traveler is quarantined, get them to someone who can test them? What is the actual process?
So I'm not sure about whose responsibility is, and I have no doubt, since we've only identified cases in returning South Africans, that some tourists may not have revealed their mild symptoms. I'm just raising that. I don't know. It's just interesting that we have, before the lockdown, we had a number of tourists, and perhaps there weren't enough, who may well have been infected but weren't tested. Either they didn't know where to go, or they chose not to do that. I don't know. So the person would be tested, and if they should be quarantined in their room. Some room service where you protect your staff. You don't want the table to be laid out and lots of contact with the guest. And if they are positive, they probably could stay there. If you're not happy to hold them, they'll have to find somewhere else to put them. And I think that somewhere else at the moment is a problem. There are some plans for step-down facilities, which are not high-level hospital facilities where actually you don't want people who are quite well, but for people to be there for, the time. That's still in development. We've had some tourists arriving at OR Tambo who either are picked out of the queue because they don't stop coughing and sent to the clinic. The temperature monitoring is obviously very limited. If you don't have a temperature when you go through, you won't be, taken out. And then they're stuck. They have no relatives. They have no home. You can't phone a hotel and say, I have a patient who might be corona and we'd love you to have them as a guest. Most people will say no, not all have. And a couple of those we've had to put in hospital. Most recently, we put 2 awaiting result guests, visitors, into a step-down facility where I think they were quite happy and they had very good care. If they don't have medical aid, they go to a public facility. But yeah, I think that's an issue.
And to
the numbers increase.
Organize the testing, sorry to interrupt you, Prof, to organize the testing. So there's hotlines and there are loads of telephone numbers.
It's very easy. You go on websites of private laboratories. There is a form that you have to fill in. There is a list of where the testing stations are, and you simply present yourself. You shouldn't go to an emergency room in a hospital and just sort of sit in the queue. Preferably not go to a private doctor unless you phone ahead and say, look, I'm a little bit concerned. Remember, not all coughs are corona. And I think that's there are older travelers who've got other causes of pneumonia. And when everything goes through the corona channel and you're negative, you're going to have people out there who say, I don't have corona, and just neglect what could be another cause of pneumonia. And that's a little bit of a concern at the moment. So they may have to be seen by a doctor, and not lost in the system, and then you find them dead in bed.
Right. Dead in bed. That's an interesting term. Thanks for that, Prof. Right. So another question for you. Will all establishments or attractions that welcome over 100 visitors at a point in time have to hit their number? Must they close?
So I think it's not establishments that welcome more than 100. I think what we're referring to is mass gatherings. So 100 people congregating in a limited space for a period. So you would have a sporting event where there are 100 people gathering at the start and all participating in sports together. You have a church gathering. You have a conference of more than 100 people all in the same room for 8 hours a day. It's not 100 people staying in a hotel in separate rooms. That is not a mass gathering. That's a very different scenario. Yeah. They're in their own rooms. They're not together. They're socially distanced. They might come together in a dining room, and you need to do some things there to reduce risks if people are coming for long periods.
I just wanted to ask you to reiterate the website address where you could get the resource on where to find out where you can get tested, because we have had a couple of instances where they've gone somewhere and been told, no, actually you have to go get tested at your doctor's.
No, so that has all changed over the last week. Everything is being ramped up by the day. Certainly last week was the tests were done at the NICD initially. You want good quality, you want to know how it's being done. But in the last week, they've been rolled out to private laboratories, and they themselves have rolled them out and set up testing stations out of hospitals generally. So it's AMPATH or Lancet or PathCare websites will inform you where to go. They're all offering very similar tests, and there is also a form that needs to be filled in with your details that should be done before the person goes. So you don't need to go through the doctor, but you need to look at the criteria. It's not about the worried well. It's not about people who want to go home and think they need a COVID-19 negative result to travel. It's really people who have symptoms. And so at the moment, it's not just you and I who might cough in the community. And that's, you know, is going to be an issue when we move into community spread. It's people from high-risk countries who've got respiratory contacts of those who are known or suspected cases. We're doing health workers, we're doing unexplained severe pneumonias to try and get a sense of community spread. It's not the worried well.
Prof, is there anything else you'd like to leave us with as a parting shot? I'm very grateful to you that you've given us so much time. Anything else that you'd like to mention for us?
You know, it's changing by the day, it's changing by the week. A lot is being done, but I can tell you, even in well-resourced countries, it's quite a struggle. I think it's going to go on for a while. We just need to bite the bullet and try and make South Africans perhaps use facilities more. I think people are very frightened to even go anywhere. And I think that's something that we need to work on. I think at the moment we're in panic stations, and you can go to a restaurant, you can go away. You know, I think we're not in complete lockdown, but people at the moment are very afraid. So welcome all your guests. What can I say?
Even though we were told in the President's address to avoid non-essential domestic
and I think non-essential travel, but if you go, you know, you can go by car, you know, make some common sense. So I think he told his civil servants not to travel. And I don't think we want large congregations of people anywhere.
Quite. And I think that the words you've just used, common sense, really at this time, it's very difficult to have common sense, but really I have tried very hard over the last couple of days to rely on it, and it's served me well, so I will carry on with that. Others too.
But I think what the important thing is, we're doing draconian things and things that are going to hurt everybody to, you know, protect those who are most vulnerable, who are most at risk for severe disease and dying, and protect our health system. That is why people have to do and be part of this.
Thank you, Prof. We will let you go. You're welcome to stay online if you'd like to.
I think I'm going to go. And if there are any questions, you can send them through. Yeah. I can't promise to answer them quickly. It's very busy.
It's fine. Thank you for everything that you've done, and to your staff as well, and for all of those who are at the coalface helping us get through this. We really appreciate it.
Thank you.
Right. Okay, Judi, you are up next. So if you would unmute yourself. So we've had a look at the micro environment, if you will, and we are so privileged. Sorry, from a macro perspective, thanks to your insights from a NEDLAC sessions that you have been in. Would you like us to just give us a little bit of an overview, and then we'll jump into the questions that are specific to you?
Great, and thank you so much to both Tony and Prof. Lucille for their excellent contributions. And I must say, this is very exciting. 448 participants, and the questions are coming in live and fast, and they're difficult. So maybe I'll start with a 30-second overview of NEDLAC. I'm not going to assume that everybody understands NEDLAC, nor has confidence in NEDLAC, because firstly, the first comment I'd like to make is that this virus is calling on all of us as South Africans and South African in the business space to review and renew our trust complement with regard to government, because if we start from a position of a trust deficit, we are not going to work together. So if we suspend that equation, then I think the possible future fundamentally begins to look different. So number one is mindset. So NEDLAC really is a vehicle by which government, labor, business, and community organizations come together. And in the main, it is to discuss public finance and monetary policy, labor market policy, trade and industrial policy, and the development policy. And it is governed by an act which was promulgated in 1994. So COVID-19 presented an unprecedented situation for NEDLAC. And on Monday, when government and the partners, you call it the social compact, came together, it was the first time in the history of NEDLAC that the business the way of doing business as usual was suspended, and we agreed to do it differently. And this is very unique, and this is the spirit in which the country or the government is asking for all of us to work in a spirit of cooperation, collaboration, and common action. And that is very important. And out of the meeting on Monday, I think some of you may or may not have seen the press statement, but the press statement really outlines at a macro level what government, labor, very important, labor, and community, very important, that we committed to a broad strokes approach to how we could possibly deal with this. And as Prof said, whilst things are cast in stone, much of this is unanticipated, and we're also needing to be innovative in how we respond. So the areas that we have outlined, and again on this webinar you can decide whether they should be different and how they should be different, and I'll come back to the mechanisms, the structured mechanisms for dialogue. First and foremost is enhancing the public health response, because if we don't deal with the public health response, then everything else begins to fall away. And in terms of enhancing the public health response, it was number one, the containment of the virus, number two, the security of health supplies and medical equipment. And then we go into workplace adaptation, support to workers and companies who are negatively impacted by the virus. And so the three major work streams that have been conceptualized in terms of how we will go forward is number one, health, number two, labor, and number three, the economy. Health is quite, on the one hand, you could say it's self-explanatory, and I'll outline the current work streams for health. That hit the ground running, and Professor Lucille is part of the health in terms of immunology, virology, pathology. There is a whole NICD work stream. The second area is labor, which a lot of the questions on the webinar and the questions that came through before fall into the labor category around UIF, PAY, etc. And then the third macro area is economy. So at the moment, the health and health meets almost every second day. Labor is in the process of constitution. The chair for labor is not, it will be announced this afternoon. Health, incidentally, is being chaired by Stavros from Aspen, and the economy is chaired by Martin Kingston from, I hope I get it right, he's currently with Rothschilds. No, he resigned. He's no longer with Rothschilds. He's an independent, internationally renowned banker. So what does this all mean for us? So the way in which it's structured is that each of these three macro work streams will start a plan of action. What we've also decided as the business community is that we need to continue. We're not going to wait for government to, government has its own processes. So we are coming up with recommendations. And let me give you one concrete example. The track, trace, and monitor solution has been developed by one of the private sector institutions. It was presented to the minister on Monday afternoon, and it will immediately be rolled out because we do not have an effective track, trace, monitor system. So you can already see that once we go to government with a solution and we can convince government, they gave us the green light. And this is going to be very critical in terms of the way we move forward. We've also been able to mobilize the four big consulting firms, PwC, KPMG, Deloitte, EY, because we do not have the capability for project management. And the nature of this pandemic is such that you need a very sophisticated project management capability. All these four companies I've mentioned have pulled together. It's not about proprietary tools. They will all work together they will work together to formulate a common platform. Because what we need at the moment is integration of all our efforts. And here we come to say our sector, tourism and travel, because all the sectors are meeting. They are all meeting with their respective line ministries. But at some point, there needs to be integration. Once the integration is there, we need to formulate the direction in those 3 macro work streams, and then decisions are made. And the decisions will be made on the basis of trade-offs. So whilst I may have a particular view, and let me put my view out there to all of you, you may not agree, but we can all have our view as South Africans, that there should be a 14-day lockdown. It's Easter, we locked down because this has been one of the most effective mechanisms deployed across countries to do containment and to slow down the curve. So I'm being provocative with that. You can begin to chew on it or mull over it. When we come to the health stream, what has become very clear to support what Prof has been saying, the key areas around health is the testing and the pathology labs, making sure that we have sufficient pharmaceutical materials in the country, especially the active pharmaceutical ingredients, hospital beds and ventilators. Just to share with you, the country has 5,000 ICU beds. 3,500 of those beds are within the private sector. But in the spirit of collaboration and cooperation, already the private sector has agreed to work in partnership with the public sector to deploy a mechanism of freeing up some of those beds. Capacity and resources become very critical, both in terms of frontline healthcare staff, and I'm sure you're aware of initiatives that are underway around how to increase frontline staff, especially nurses. But what has emerged as almost the most crucial is a coordinated communications campaign, a national campaign, so that it can extend to the length and the breadth of the country, where we can ensure that we get buy-in around the behavior changes that are required by each and every suburb, so that you contain the vector of transmission from the suburbs to the shacks. I'd like to just repeat that, to contain the vector of transmission from suburbs to shacks. So I will conclude to say that we have identified Siyaxolisa to be the key driver of the communication in terms of all South Africans responding to his call. As I speak, we are busy shooting the material shooting the public service announcements, and he will drive the communication campaign. And of course, what has been very critical in all our minds in the private sector is that our lived realities are very different to the lived realities of the majority of the unemployed South Africans. So I'm going to pause there and with one of my favorite quotes, and that is, "Fortune favors the prepared mind." It's actually not mine, it's from Louis Pasteur, the man that came up with one of the most famous inventions. Fortune favors the prepared mind. And so moving forward, I would, coming also from the tourism and travel industry, is to ensure that as a sector we plug into the 3 macro streams that South Africa Inc. has committed to work together within, in the spirit of cooperation, collaboration, and common action.
Thank you, Judi. So obviously one of the big macro work stream that we've received a lot of questions about is around economy. And, people are asking what recourse we have if a full state of emergency is announced, or if businesses are forced into lockdown.
So again, like the professor, I don't have the answers. I do know that some of the key lawyers in the country are already applying their minds to all kinds of relief packages. And so hence these questions, again, through SATSA, SATSA, I'm sure through TVCSA, I'm not sure on the mechanisms, but all these questions and possible solutions need to be funneled into the Labour Working Group. I do think by this afternoon, one of the Labour experts will be appointed, and we can have them grapple with the how. At the moment, we do not have the how we will do it. There's been a commitment from the Minister of Labour and the Minister of Finance to look at different contingency funding that is available, even though we do not have a lot of money left in our fiscus, there are pockets of money that can be leveraged in order to do redress and to support distress, businesses in distress, severe distress.
Such as the UIF?
Yes, such as the UIF, PAYE. There is a contingency fund that government has. There is an emergency fund. And there's even talk not only for South Africa, but globally around the IMF and the World Bank, because the World Bank and the IMF have in the past made funds available with no contingencies in terms of how they would lock you into a structural adjustment program. So that has also been put on the table as possible sources of additional funding. Through the American USAID fund, already approaches have been made to PEPFAR, which has in the main funded to the tune of billions and billions of dollars the HIV strategy, not only in South Africa, but globally. So already communication has been initiated with some of these key external FDIs.
And we can lean on you and on NEDLAC to ensure that we're providing those updates through to members. So just keep looking at the SATSA microsite, and as and when we have more information, we will definitely post that. For those of you who have joined late, if you do have any questions, we are not taking questions actively on the current webinar. There are just too many for us to field. If you would like to post your question, and we would welcome your question, please go to the survey link that I have posted a couple of times in the chat, click on it and add your question to the survey, and we will deal with it separately on the SATSA microsite. Judi, so we've been talking very high level macroeconomy. Let's bring it down to practicalities. What can we do as tourism businesses from a practical perspective to help safeguard the industry, but also to ensure that our businesses ride the current situation, which is so completely evolving so quickly at the moment? Do you have any practical insights for us?
Yes, I will venture into the terrain, and I think first and foremost we need to look at and be very, I don't want to use the word scientific, but maybe scientific around doing the projections, and then look at the businesses, you know, which part of the value chain in tourism is going to be hardest hit, and how do we want to cushion that net effect of those hardest hit. So I really think in terms of our community tourism businesses and our SMME businesses, I mean, the term is always used that tourism is a consequential business. So how do we want to protect those that are most vulnerable in the value chain? Because some of us have shareholders that may deal with issues of liquidity and release the tight hold over the purse strings. So again, if you look at balance sheets, those with balance sheets, as opposed to that who, if I'm not paid in 30 days, my business collapses. So definitely from the SMME space, I think the relief is going to come there first. So as SATSA, we need to have our databases in order. We need to have a hierarchy of needs so that when we approach government, we can say, here are the 500 businesses. This is what they need, and this is the bailout. So in a way, you're looking at bailout packages, then you're looking at stimulus or stimuli packages, and then critical, the banking sector met on Sunday, where there has been a request for the banking sector to review their loans, the way in which they finance business, and almost have a vacation for 2 to 3 months around repayments. So that would be very practical. But businesses that were already compromised and distressed because of disintermediation, I'm not going to tell you whose favorite word that is, I'm sure you know, that businesses that were busy being rendered obsolete, it's not those kinds of business. So you're looking at the local shops where the local businesses that may be, and medium-sized businesses that we need to protect, because when this passes, because it will pass, everybody's going to be in need of a holiday. And if there are no products, if there are no channels, then somebody else is going to step into the spaces where we've been for 20, 30, 45 years.
Okay, Judi, any last parting comments before we let you go and hop on to our next topic?
I just feel that in the tourism business, because we're a service industry, a service business, we're a caring business, and we're a compassionate business, now is the time for us to band together and have a collective response. And I think we'll do it. And we're going to rise out of this. We'll rise like the phoenix out of the ashes. And we need to keep hope alive, because the other businesses are not going to be like us. I mean, you know, it doesn't matter how bad the customer's been, you put on that smile and you say, how can I help you?
Thank you. Judi, you're welcome to stay. I'm also very grateful for your time. If you need to run, I completely understand. If I could ask you to mute yourself, which you have done, right. Tony Romalee and Martin Wiest, put your business hats on, because you are now on the hot seat. So if you wouldn't mind unmuting yourself, we're going to get into the nitty gritty. And I think really the bulk of the questions that we have received from SATSA members, is particularly over the last 2 days, have been around how to manage your business at the time. Most SATSA members are small owner-managed businesses, and you know, they are grappling with trying to keep their businesses running, trying to ensure that their staff are kept safe. And they have loads and loads of questions with regards to cancellation policies and travelers currently in South Africa, what to do with those. So I'm going to lean on Martin just to talk about the list of high-risk countries that have laws that stipulate if the borders get locked down, that tour operator or travel provider, do they have to refund the client in full? And does that mean that South African suppliers cannot or should not change cancellation fees despite what their terms are?
Thanks for a really complicated question, Nats, because it depends very much on the laws of the individual countries. I think that the departure point, and I think that's the important part, is that we have two totally disconnected contractual obligations, and it really depends very strongly if the DMC in South Africa specifically describe themselves as a principal or as an agent on behalf of an overseas entity, and what that actually then physically means in terms of their positioning in the channel. So let me assume that the DMC in South Africa portrays themselves as the principal. Then you have two distinct contractual obligations. The one contractual obligation is between the DMC and the supplier in South Africa. And the other distinct contractual obligation is the obligation of the overseas entity to the South African DMC. If a country determines a force majeure, such as happened in Germany, the contractual obligation of the overseas entity with a local entity is in essence, depending on the contract and the content in the individual contracts, depending on those, is effectively nullified. Whilst simultaneously that force majeure that was called in that contractual obligation is not connected to the local DMC to supplier contractual obligation. And hence I fear that purely contractually, since they disconnected, the DMC ends up carrying the can, and hence why it is critically important that there is enormous amounts of flexibility from supply chain.
Just on that topic of force majeure, so I know the question was asked in the chat, who declares that? Government?
No, force majeure, it depends again. In the context of South Africa that has Roman Dutch law, and I need to highlight that I'm not a lawyer, but I've obviously spent an enormous amount of time with lawyers in the last 7 days, because this has been a journey of phenomenal learning. In Roman Dutch law, force majeure is not particularly well described. So force majeure is normally described within your contracts with your supply chain. And then those contracts and the definition of force majeure in those contracts are the ruling definition.
So what I'm getting from you, and I'm very happy for Tony to jump in as well if he has additional insights, is that it is a little bit of a moving target, and there really isn't a clear and comprehensive cancellation policy that one can put in place to say this is the rule of thumb for a traveler from a medium or a high risk country? Would that be a correct assessment?
Yes, I would say so. We can give some recommendations, but there isn't a hard and fast rule that applies to everyone, as far as I'm aware.
But if they're not allowed...
And Natalie, if I can broaden on what Tony said just now, most probably and again, it's a moving target, and it'll be interesting to see how a court will see it. As the crisis deepens, I guess everybody is trying to protect their working capital. The overseas wholesaler is going to try and protect their working capital. DMC is trying to protect their working capital. The supplier is trying to protect their working capital. And I fear, despite Judy's call for a collaborative effort, which I think is 100% correct, as the problem deepens and as liquidity becomes an increasing problem, I think people will act more and more selfishly, and people will end up looking at their contracts more deeply, and they will enforce their contracts regardless of what the collaborative effort says. Now, the reality is, if you wanted to invoke a force majeure in South Africa, so from a DMC to a supplier, that normally a force majeure is relatively clear. The hotel has burned down, a flood has flooded a game lodge, or whatever the case might be, and the supplier is no longer able to fulfill their contractual obligations. And this is not the case. The case here is that the supplier is well in a position to fulfill their contractual obligation to provide a bed, but the DMC is no longer able to fulfill their obligation to deliver a customer into that bed, and that's where it's going to get sporty.
Oh, I see. So saying that, you know, suppliers need to come to the party and offer the full refund is kind of a moot argument, essentially, because the beds are there.
There's two components for me there. There is a ethical, moral component, and then there is a long-term business objective component, and then there's a contractual component. I of course think that extraordinary times require extraordinary viewpoints, and I think contractual viewpoint to look at the contracts it's the wrong time to look purely at contractual obligations. I think this is an ethical, moral, long-term business objective topic and not purely a contract topic.
So how do we get suppliers to cooperate and relax their cancellation policies?
Come on, Tony, up to you.
All right, I'm there. I think, as you said, Martin, I think it's got to be really effective two-way communication. It's very hard. I mean, we've had DMCs prescribing to us as opposed to engaging with us. The overwhelming consensus amongst suppliers that I've been dealing with and liaising with in preparation for this, and just in general, is to be as cooperative as possible with the relationship with, firstly, the guest who is paying at the end of the day, and the intermediaries who are bringing the business to us. So yeah, we need to cooperate. We need to share the burden. And if you want to, you know, a consensus on what that looks like, you know, in the most cases, it's a postponement of a booking to a future period, or at least a passing of a credit, and not asking for any further payments that may or may not have been made.
Let's talk about postponement, because we have received a couple of questions around suppliers charging higher rates, peak season rates, for example, for postponed bookings. Is it feasible for us to have some form of industry guideline to avoid this type of internal fighting, or is this again, you know, a situation of communicating and saying, look, we're in this together, we have to share the pain, etc., etc.?
Well, yes. My view, sorry, Martin, my view is that if we've done the deal and we've got the money, or even part of it, that, you know, we should pass that, we should hold the rate for a fixed period of time. you know, a 12, 15, 18 months, whatever, you know, is deemed to be reasonable. But that's my view. It's a mixed view out there, but there are a lot of people who agree, and there are a few who don't, as of course we know.
Mart?
We are, and I largely share the view with Tony. The one thing that I think is going to be really, really interesting is that I guess rate level on the supply chain side is a function of supply and demand. So the rate that was relevant for this March that gets deferred to next year March might actually be far too high. Because let's not forget that when tourism comes back and when the silver lining, when we rebuild our industry, and we're not rebuilding this industry only in South Africa, we're rebuilding this industry globally. We're going to have to compete globally with other destinations that have identical issues as us, where we have to rebuild our industry, rebuild our businesses, rebuild our skills and everything else. And supply and demand will determine at the time what is the relevant rate. And the rate that was charged this year might be not only too low for this year, it might well be far too high, especially in a global context where everybody's going to fight for market share.
So quite feasibly, we could have a situation where we are putting 2020 rates in for 2021.
Quite feasibly, we could be in a 2016 rate for 2021. You never know. It really is a function of what the demand curve will do post this sporty time. Natalia, if I can very quickly also come back to contractual obligation, one part that I didn't touch on earlier on, if I may.
No worries, go for it.
I think it's very important when we make decisions around cancellation fees, when we make decisions around terms and conditions and contractual obligations, that we simultaneously, all of our businesses, have a look at the various implications from an insurance perspective. Business interruption insurance, cancellation insurance, on the DMC side, overseas wholesalers, business interruption insurance, and last but not least, the travelers, the ultimate consumers travel insurance. Because I think what we need to be very mindful of is in our quest to be collaborative and assisting, if there is a ability for insurances to step in, I don't think that the suppliers or the DMC should carry the can. So depending on the downstream ability to claim damages from insurance should certainly also inform our decision how we treat cancellation fees and deferments, etc., on a case-by-case basis.
So the insurance thing for me is also a little bit of a moving target. And I know Danae's actually just put it into the chat, and I've had lots of conversations with people around this because it's quite unclear as to what is covered and what isn't covered. So I'm finding with the SATSA members that as they are speaking to their insurers, the insurers themselves are not really, I suppose that's insurance, I guess, definitively stating what is and what's not claimable. Do you have any specific insights, Martin or Tony, that you're able to share around that?
Well, just from personal experience, in one of our clients, they've been very clear that we're on our own, was their exact words.
Right. But travel, yeah.
Natalia, from my side, it is very dependent on your insurance documentation, on your descriptions, on your exclusions, on your geographical areas, on the events. On the division of it, on the definition of event, and on the definition of period of event. So I think everybody has a different insurance documentation, and I think it's very important that everybody has an in-depth look at what it is and consult legal counsel if it's unclear, because I certainly have read more insurance documentation than I would ever have cared for over the last week, and I do read English, and I think it's sometimes very difficult to understand. So I can only recommend people to consult an expert to have a look at the insurance documentation.
And of course, there's insurance for business, but as you said earlier, there's insurance for customers as well. You know, does force majeure cover the actual client's travel insurance? These are all questions that we would probably need to pitch to a travel insurer. And I think that would be a very good follow-up webinar for us to do. So we'll put that in the pipe and we will follow that up at a later stage. So once again, if you've just joined the webinar, and we've still got over 400 people on here, so that's amazing. If you have a question, please post it in the survey link that I have put in the chat. We will deal with the questions in that survey link as opposed to all the questions that are coming in on the Q&A because the volumes are too high. I'm going to walk into a little bit of an ethical area at the moment, Martin and Tony, and that, you know, the vitriol around encouraging people to travel at the moment, and even with Prof. Blumberg saying, you know, travel domestically, and seeing what happened to MSC this week when they carried on with their cruising and were basically the subject of a lot of negativity and bad publicity as a result. People are afraid, they don't want to travel. Should we as travel businesses be reassuring our trade customers and their customers internationally and locally that it is okay to travel if they're not from high risk or medium risk countries? Or should we just say, let's take the pain now and not encourage travel?
Well, personally, I would say that exactly. I think we should take the pain. All the evidence, for lack of a better word, is that, you know, the worst is yet to come, but that the sooner you shut down, and Judi's recommendation I concur with personally, the sooner we'll come out of it.
Martin?
I think it's largely academic, because if you have a look at the source markets that are currently either high risk or medium risk, and in essence don't have access to South Africa, that sort of covers, I guess, 80% of the volumes to South Africa. I think the question will come at a later stage, and again, this is my personal prediction. My view is that most of our core European source markets will get through this within the next 4 to 6 months. So by August, they'll hopefully be done and dusted with it. And as the Prof said, in South Africa, we'll certainly not be done and dusted with it. So I think the moral ethical question that we have to ask ourselves is what's going to happen for September, October, November, our peak season. Because, and I guess, again, I think it could well be an academic question, because if I live in Europe and I've just come through this coronavirus disaster, I'm highly unlikely to go and travel to a country that still has a high infection rate. So as a result of the non-synchronized position of the virus and the infection rate, we'll be lagging 2.5 months behind the rest of the world, fortunately. I fear that particularly September, October, November, which out of Europe is a very important season, might not be happening. And I think our customers or the consumer, regardless what our encouragement is, which is your question, will largely continue staying in Europe and not travel to us.
And it may actually not even be up to us and how we promote ourselves, because those destinations might decide to put a travel ban in place for South Africa because of the high level of infection. So as you say, it's kind of an academic argument.
I think it's an academic argument. I think all of us should plan for the fact that 2020 is largely a write-off, and that we start rebuilding our businesses in 2021.
Okay, I'm going to let the two of you just think of your closing comments, if I may. I have had quite a lot of questions around the closure of seaports and cruise ships. Let me make it very clear, because the Department of Transport has thankfully made it very clear. And in the words of the esteemed Minister of Transport, who's very, very eloquent and quite funny if you do listen to him, you can go and have a look at the transcription that we put together last night after the Department of Transport briefing. There will be no cruise lines that are allowed to dock with, or at least passengers from high-risk countries that are allowed to leave the ship if they arrive in South Africa. That is just an absolute no-go. And his words, no more cruising. So have a look at that transcription. There's a section for cruising specifically. And if you have a question around cruising that is not responded to in there, let me know through the survey and we will endeavor to answer those. Right, Tony, if I may call on you, do you have any parting shots for us before we let you go?
Yeah, I do. I think I'd like to, I think we all need to follow the lead of the government, and I'm very encouraged to hear of a strong national communication plan. I think we need to follow that lead. I think it's heartbreaking for businesses that are on the edge or potentially going to go to the edge to have to face the prospect of short or longer term closure, and we have to respect that. So if there are businesses that are looking after local travelers that have to stay open, then A, follow the lead of the government, and B, act responsibly in everything that you do to your people and to your guests.
Thank you, Tony. Martin.
Yeah, for me, the critical issue here is that at Tourvest we employ just under 6,000 people. We have to me, it's very important that we understand that we first and foremost have a responsibility on our people, on our staff and their dependents, because in the current economic circumstance, whoever is out of a job is unlikely to find another job, certainly in our industry in the foreseeable future, number one. Number two, I share Tony's view entirely. We have a responsibility towards our staff's health and the immediate surroundings health, and we have an absolute responsibility, as Judi says, that this doesn't spread into our more vulnerable communities, because the ramifications would be so much bigger. So I think that's very important. But thirdly, we have as business leaders, we have a responsibility to ensure the financial sustainability of our companies, because if we can't be financially sustainable, we don't have the ability to look after our people, and we don't have the ability to look after communities. So to me, it's going to be a really difficult balancing act between looking after the company with all of its stakeholders, supply chain, customers, etc., its people and the communities in this country. I don't think the book on this has been written yet. I think all of us are exploring new land, and I encourage us strongly to share amongst each other, to share experiences, to share insights, to share trade secrets and all of that type of thing, because the more we share, the more successful we'll be.
Great. Thank you to both of you. You may mute yourselves, and thank you to all our panelists for sharing so much information with us. We are going to be sharing this recording of the webinar latest tomorrow, and we'll put together an FAQ based on the contents of the webinar. So just keep a look at the SATSA coronavirus page. You just go to satsa.co.za. I'm going to hand over to David. He's going to close the webinar off for all of us. So David, if you would unmute yourself, please. And there we go. Right, the floor is yours.
Thank you, Natalia. Firstly, thanks to all the panelists. Really appreciate your time, guys. I think this has been an incredibly useful exercise. I think that the learnings, whilst we don't have all the answers, are particularly important and salient. And I think, Martin, you just really hit it on the head. We've got to carry on sharing, guys. We've got to share right through this storm we're going into. The more we share and the more we open and transparent and honest with each other, the quicker we'll get to equitable solutions. So from a SATSA point of view, I think a lot of the work we've done over the last couple of years has put us in good stead. I think we, although we don't always agree with each other in different parts of the value chain and the segments, I think that we have developed great relationships. I think we're a strong organization, and I just want to commit that we will continue to do two things. We will continue, firstly, to lobby tirelessly that tourism is seen and considered at the highest levels, and it's got to continue to be seen as a priority sector, because notwithstanding the fact that we might come out of this later than other destinations in the world, the tourism industry will bounce back a lot more quickly than any other sector in this country. And to that extent, we need government to put its money where its mouth is in terms of support and just considering this as a priority sector. So, I mean, it's great that we had Judi with us. There's some avenues through there. We will continue our dialogue and our messaging through the Tourism Business Council, and they've been doing a really good job in that respect. What I also would like to commit to, because this thing is moving incredibly quickly. I mean, conversations we had last week are absolutely anachronistic. They're out of step with the present. This thing's moving very quickly. So what I want to do, just to suggest to everybody, is that we make this a weekly webinar. We will pull in relevant people into the webinar, and I think the suggestion, Natalia, to get a representative from the insurance industry, both possibly here as well as maybe internationally, into that conversation would be a particularly good one. I want to urge members to please just look out. We will continue to message everything through mailers. We will put notifications on the SATSA app, and we will post stuff on the SATSA microsite on the website. So look for that stuff. Please don't stop sending us questions. We've been fielding, I mean, literally hundreds of questions, and we will seek as much as we can to get you timeous answers to that. So I just want to conclude by sharing with you an incredibly poignant conversation I had this morning with one of our SATSA members who came via the SATIC merger, a lovely woman called Kym Whitaker, who has been diagnosed with the virus. She was case 42. She's an amazingly courageous woman. I've known her for a while. She runs the Curiosity Backpackers, and she's put a blog up where she's detailing her experience of having the virus with her young family and what she's doing. So if there's any way we're going to dedicate or do anything, I'd like to dedicate this webinar to Kym. Our strength is with you, and let's all get through this together, guys. Thanks so much for your time.
Thank you, David, and thank you again to all our panelists. On the topic of sharing information, please do share information with SATSA so that we can collaborate with you. Do not share information that is unverified, please. This is a request from me personally, because we see a lot of the information that is being disseminated which is unverified. So if you are unsure as to the source of the information, if it's not official, please pass it through us and we will find out whether or not it is official. On that note, it is 4:30. I'd like to close the webinar off. We will see you again next week. We will send you some information about our next webinar. And thank you to all of you for giving us an hour and a half of your time to discuss this very, very, very important topic. Have a good evening and a glass of wine. Cheers.